right, welcome to the Human Services Committee. It is February 10th at 9 a.m. I will hand this over to Commissioner DSS.
Okay, first, I'd like to request a resolution to contract with Opportunities for Otsego for the Residents with Domestic Violence Program in the amount of $160,000 per year.
Is there a motion?
Second.
And this is similar to last year.
Yes, exactly the same.
Okay. Any questions? We're contracting out to 2030.
I think that's enough. That should be for 1 year.
Okay.
That's starting to read that. That changed my mind.
So it's just this year.
Just this year. 12/31/20.
160,000 for the year.
It's like that is wow. Okay, are there any further questions? Hearing none, move to a roll call vote.
Martino.
Aye.
Bazile. Yes. Crockley.
Yes.
Mendez.
Yes.
Clapperton. Yes.
Hearing no no's or abstentions, the motion passes.
Thank you. And then I provided y'all clear plan update that just has stats basically because our priority outcomes are the daily work that we do every day. So there's a description of those and then the stats for 2020.
Disappearing on my phone.
All right. But if we need a litter robot.
Yeah, now we know where to go. From WBNG.
Perfect. Are there questions on the update? Do we have numbers from 24 or was the clear plan not? I don't.
It wasn't, but they're in the annual report
Got
out
it.
online.
Easy and most.
All right, and then I wanted to let you know that we'll be contracting again with probation, doing MOU for the calendar year. Provide hotel techs for us and at no charge. Okay, and then under personnel, we hired 4 new caseworkers. A temporary caseworker and a clerk. And then new vacancies, 2 caseworkers, 3 clerks, social welfare examiner, counselor typist, and a casework aide part-time. Okay, so for motel monthly stats, at the OFO shelter, we have 6 families. Motel 88, 5 rooms for regular TA clients. Crossroads, 22 individuals. At Jeannie's, 6 individuals. Agency housing has 10 homes occupied. And Super 8 has 2 individuals.
And so, I'm sorry, Super 8's
2, yeah.
And for OPD stats, they had 19 calls to Motel 88 and 11 of those were DSS code blue housed individuals.
Are there questions? There other business?
I have a question or something Sarah already know something I'm gonna ask about, but yesterday in the news, which was the article I was trying to pull up, there was Shenango County Catholic Charities used opiate settlement money to purchase and upgrade or purchase a better warming station that holds more beds than they previously did. So they were occupying a warming station that had 10 spaces like ours, and they purchased a new building with $300,000 of opiate settlement money for a building that will house 15 individuals.
Mhm.
And I'm wondering if that's obviously their warming station is also run by Catholic Charities, right? It's not run by us, but if that's something that's ever been considered with Otsego County's opiate settlement money.
So I can say so there are two pots of opiate settlement. There is the pot that's handled through ARS, community services. And then there's a pot that's handled through the, county toward opiate task force, which I chaired.
Right.
I would need to look at how Sinead is doing it, because if their restrictions are like our restrictions on how we can spend that money, I'm not sure that would be a viable thing we could spend it on. According, like a building for Code Blue. I'm not sure, are they planning to do something else with that building too, was my question.
I mean, the article doesn't say that. It's,
I think wraparound services.
Yeah,
Service providers go there to provide and be a drop-in center as well.
Right,
So it
so that's a
says
different,
So
a
it's preventive.
grassroots effort of community and wrapping around these individuals as well. We'll have contracts in place with DSS and their outreach workers, behavioral
Yeah.
health, peer substance abuse providers,
yeah,
and churches.
so that would be something to look at.
Yeah, because it would be preventive services, right, which is
Correct.
allowed under the.
Correct.
So this is only during code blue, I mean, is it just, it's the,
I mean, the article is pretty brief.
Right.
It just says Shenango Charities, Catholic Charities of Shenango County recently relocated the county's lone warming station and emergency shelter to O'Hara Drive in Norwich. It says the new facility offers 15 beds, open from 5:30 p.m. to 8:30 a.m. It talks about how it's an upgrade in the number of people there that it can hold. There's a kitchen, community room, beds, bathrooms. The building was purchased for roughly $300,000 using opiate settlement funds. It sits across the street from the Catholic Charities building. I mean, it's a pretty brief article, so.
Yeah. I mean, that definitely something to look at. Yeah, but just buying a building for Code Blue shelter
Right.
with opiate money is not.
Yeah.
Right.
Within the scope of what we could use that money on, but if they're services, that is different.
Right.
So it's something to go.
Yeah, that'd be awesome.
Other questions, comments? Anyone? Okay. All right.
Thank you very
Thanks.
much.
Have a good day, everybody.
I didn't see you come in, so I was like, she's either up there.
Thank you. So good morning. Today I am on my way to Albany after this to testify at the budget hearing for public health funding, so well, not excited about that, but
But it's important.
It
We
is.
appreciate
It is.
So.
yes, yep. So just a few things. It's our busy season for respiratory illnesses. And since January 1, we've had 332 cases, lab confirmed cases of influenza. That brings us to a total of 929 for the season. We're starting to see an increase in flu B. Predominantly it was flu A, but B is starting to, we're seeing more cases of B over the past couple of weeks. We've had 71 lab reported cases of COVID in January, since January 1, 49 in December. Sorry. I think it's 71 since January 1st. I'm confusing myself. Starting to see a bit of an increase in RSV. We have had 33 cases so far in 2026. And last year, in 2025, we had 202 total cases.
Still a good time to get your flu shot?
Yes, yep, still get flu, COVID, RSV. If you're in the recommended populations, you should get vaccinated. It's still protective. We are working on our rabies clinics. I'm scheduling the rabies clinics for 2026. Our vet, who did a lot of our clinics, is retired. So we're looking
for new vet, but I think we have them all scheduled and hopefully that will be confirmed in the next couple of weeks and we'll have that published. I know some of the other counties surrounding us have had theirs published, so people are kind of asking us for ours, but it will be coming. I'm gonna skip over the corners if that's okay. Okay. And I figured, we're working on our annual report, so I'm not really gonna go really into too much detail of our the strategic plan, because I would rather have an annual report to give you. But this is our community health assessment that was due to New York State the end of December. It's written in conjunction with Bassett. So that highlights the health of the county and kind of the priority areas for interventions going into the next 6 years. We will be writing a community health improvement plan, which I will share when we have that written. That will also be written in conjunction with Bassett. So excuse me, we'll make sure that we're coordinating our efforts and not duplicating anything. But next month, I should have the annual report complete and I will review that along with the strategic plan for March. And then I did have one thing added for business that wasn't on the agenda. I got back a request to create fund and fill a position from Penny. So I was hoping to squeeze it in. This is something that we talked about during budget time. It's in the 26 budget. It's essentially unfunding my community health nurse position and funding the community health worker position because we've had so much trouble funding or filling the RN position. So it's asking approval to create fund and fill the community health worker at a starting salary of 49,313. Effective 3/4 after the board meeting next month. It's in the budget. We're able to claim state aid for salary and fringe.
Is there a motion?
So moved.
Second.
And this is in the budget.
Make sure.
Yes. 26. It doesn't, I would rather everybody second than Mildred's.
Yes, it's in the budget.
Any questions?
So, yes.
Yeah.
So instead of a community health nurse, they go out into the communities and, I mean,
Yeah. So this position can do a lot of what the nurse can do. Obviously can't do everything the nurse can
Right.
do. But mostly this position is going to be doing chronic disease work. So going into the community, doing education on chronic disease, working with our community-based organizations on kind of coordinating services and
Okay.
and that. So won't be able to do immunizations or any like hands-on nursing care, but we're just limited with the staffing that we can.
right, okay, yeah, I'm just curious.
Other questions? Let's move to a roll call vote.
Martin.
Aye.
Bazile. Yes. Rockland.
Yes.
Mendez.
Yes.
Clapperton.
Yes.
Hearing no no's or abstentions, the motion passes.
And that was all I had. So and I wanted to chat with you about foreigners.
Oh, okay. This is an open session chat.
I think so, right? Yeah.
Okay.
Yeah. So do you want to, I don't know, Carol, where do you want to start? I know we've talked about this in the past, about bringing corners under the health department, for like administrative.
Right.
Yeah, so I think that's, Carol's just finding it not a good fit for her office.
No.
Probably.
So just to refresh, for folks who are on the committee or on the board, the county coroners, it's an elected position. There are 4 of them. The way that it has been handled, or that department has been handled, is essentially, and tell me, stop me if I'm not right. The bills for things that the coroners need just go to Carol, or the clerk's office, and she just does the administration on them. But that means that we don't have a whole lot of oversight as to what's happening. But if more of that is under the health department, there are more kind of checks and balances on what's going on in the coroner's department. Does that make sense?
Makes a lot of sense.
So we've been talking about taking that administrative function from Carol, because I mean, I think she has plenty. And moving it over to the health department, which also has plenty, but they're better set up to handle this kind of.
And there's several counties in the state where the coroners are housed under the Department of Health.
Including their record.
Yes. Yes.
Yes, because currently the records are individually kept with each individual coroner, and they are not in a central location. And I
So
probably
I
don't need
like
to
to-
detail why that could be a potential issue.
Yeah.
Yeah.
I watch.
Well, I mean,
I'm kidding.
we're not having like CSI level issues, but
still.
it would be good to just have it all in
Yeah.
one place.
Yeah. Yeah. Secured at a county facility.
So there are questions about this plan writing. I think legally, as long as we can do it.
So can I just add a couple things?
Sure.
So Heidi and I actually briefly discussed this, that she has a medical director
Oh, that's
or
Medical director.
medical
Yes.
director that may be some of the cases or the calls could be
He could
sign off on the death certificate.
But like right now, because they're not under us, I wouldn't ask my medical director to do that, but if they are under us and that's our purview,
Mhm.
then, I don't wanna speak for him, but I think it
I
would be
think-
more of a fit for him to sign the death certificates
Is it
that,
Ben?
yeah.
Yeah, he's reached out to me about.
As well as he might be a good resource for the
He'd be
four
great.
coroners.
Yes.
Yes. Yep.
Maybe just assisting with their cases if they had any questions, because they're only coroners, they're not like medical examiners. So they're sending all their cases that need an autopsy to a specialized hospital, pathologist, etc.
Yes.
at their discretion.
Yes, and to do a little explaining, medical examiners usually they have an MD, they have some kind of professional medical degree, and are able to perform autopsies. Coroners, in this county, a lot of them are funeral directors, so they're different skill sets.
Yeah.
So it'd be nice to have somebody with medical training as a resource. No, okay.
Yeah, so I don't know what the next steps are.
I don't either. I'm gonna have to ask the county lawyers, because I feel like there's something.
I wasn't sure, and I can take a look if there is in the rules of order, does it have coroners listed under, do you know, Carol?
Coroners is listed under HSC.
Oh,
Okay, but it doesn't say who's going to be,
Nope, I only serve as the administrative function. I have no control over them. They're four electeds. My office just basically processes their bills, orders supplies, processes their payroll based on the information that they're providing to us. We are not reviewing it for accuracy, any of that.
Yeah, and sometimes, Rob will send me like the reports from the coroners and like, I know he has some concerns, so there's really nobody looking at like the whole process and what's going on.
Why don't we figure out what we need to do to make that happen? In terms of,
I think at a minimum, bring it to the administration committee. We'll have a resolution indicating that, Department of Health will now be overseeing the coroners. And if it's not listed in the rules of order, I'm not sure if we need to do anything else.
Okay, great.
I'll look into it more and
Yeah.
and speak with Carol, but I think that's.
Would there have to be a vote here?
Yes,
And then go to
yes.
admin?
Yeah, we'd have to go here and then
Go to admin.
go to admin and then it'll have to go to the full board, but,
Yeah,
um,
okay.
as long, you know, if we have to like change. Get into like the charter and all of that kind of stuff, that's a whole other, but
Right.
it doesn't seem like that needs to happen, so. So, is there a motion to,
I like the motion.
Excellent.
Second,
any further questions? All right, we'll move to a vote.
Martini.
Aye.
Bazil.
yes.
Brockway.
Yes.
Mendez.
Yes.
Pepperton.
Yes.
Okay, hearing no no's or abstentions, that motion passes. Thank you. Okay, great.
Good
Yeah,
luck.
I feel like Albany.
Oh, thank you.
And thank you for sharing this with us.
Yep.
Yes.
Time of shift schedule 9:30. 30, wow. Okay. I
Who
know
is it?
it's TV3. I don't have her, so. Yeah. Oh, good. Yep.
Helps.
No, Office for the Aging.
Pardon?
Office for the Aging?
Okay. That's true. and
Yeah, I mean, I have heard the office number.
Mine in the 242 says vacant. Oh, we have that.
Probably between here and there, so. Yeah, she-
Stepped out.
She stepped down with a lawyer. So.
How about 547-4232?
That's what I just called.
Oh, okay.
Yep.
All right, I tried.
Yes. Another.
I can go grab Jeanette if we wanna. Put fun her.
I mean, I think by the time she comes out, I could read. We could take this time to read the community health assessment.
I've got is 5477571.
7571.
There.
So looking at the county health assessment. Somebody, and somebody to explain this to me. Well, on page 11. This is just this is not a. This is just a random question. Where they have a median age of kind of each municipality in the county. Why is Edmiston's median age right around 30 when the rest of the county is?
I know, I wonder. Well, the city of Oneonta looks
I
like
mean, the
it's
city
that,
of
too.
Oneonta,
Yeah,
that makes
makes
sense,
sense.
Probably ways at July, because my son works there.
Oh, okay.
Maybe.
What's that?
New York Central
Central
and Bonnie.
Oh, great,
Yeah.
yeah, exactly, yeah, because they college grads started at these.
No, that makes sense. Thank you.
See the big.
Yeah.
That's Sydney.
Oh. Yeah, and so then all the folks in Sydney, like, yeah. Huh. All right. Miss Seeger. Are you here? If you're here, we can't hear you, so.
Looks like she's muted.
Yeah, she's muted, which might mean she's not actually here yet.
Oneonta City School District has 25 unhoused students.
Yeah, that's correct.
Well, I think Heidi just said 6 families are living at
Yeah.
OFO shelter, and the OFO shelter only takes families now. This New York State enacted a law, like maybe they're take individuals or families. So the shelter on Depew Street houses families.
Right. And so those kids would be technically unhoused because they're,
Right.
Right.
it's not permanent.
Or if there's
25
folks,
don't fit in there, do they?
no, but I'm just saying like,
It's
Yeah,
probably a,
yeah, or the DV shelter also.
yeah. Yeah, it doesn't mean that they're likely in more temporary housing situations. Neither one of you is team. We enjoy you as you are, but you are not.
Did you try the 4232 number with Jill?
I did, yep.
You
Yeah,
tried
you
it?
got sent a voicemail, so we tried. We have tried and we have failed. Penny? Oh, there she is. There she is. Yay.
Me?
We're gonna just jump ahead here because Tammy will turn up or she won't. So
So you're ready for me?
we are.
Okay, all right, sorry. I actually really don't have a whole lot, but I know I had missed January, so I wanted to pop on with the new committee. Update for our office, we did get the good news that our funding levels from the federal government, which were not looking too good, are now set at the same level we've had in the last couple of years. So no increases, but no major decrease. So that's, I guess, as good as we're gonna get. I'm happy with that.
Yep.
This last year, our area, Otsego, Shenango, Delaware, because we met all of our performance standards and all our other goals, we were issued a incentive of funding of $200,000 that we were able to use for training. It had to be used for, couldn't be used for staff, had to be used for training customers, support services, that type of thing. So we're kind of like in this, it happens all the time. We got lots of money right now, but July 1st, we won't. July 1st, we'll be kind of back to things being pretty tight. So we have been working with the Excel Center, trying to provide some funding for some trainings through there. In fact, right now we have about, I think it's 10 to 12 individuals are in the basic manufacturing class right now. It's being held right next door at the Excel Center. And that's the second one they held. The first one we didn't do any funding for because they had some grants, but they lost one of the grants. So we're helping out with paying part of that tuition. And then when that class is over with, we may possibly offer on-the-job trainings to local employers. They do like a job fair at the end. They bring in local manufacturers to meet with the students that have taken it. It's a 4-week class. So that's about halfway through right now. There's a upcoming security guard training that we're doing some recruiting for. We have some students in LPN training. Without having a community college in our 3-county area, it does make our training options kind of limited. So, it's always a challenge. We also have some on-the-job trainings going on at a few local businesses too, where we're helping the cost of training for them hiring somebody that may not have all the skills. So we have a few of those going on. So that's where we are with that. I think, like I said, going into next year, it'll be a little tight again, but we'll have some money for training, just not as much as we have right now. Also, right now, we're in communication with Department of Social Services and how to handle some of the increased numbers of people that are going to be required to do job search for receipt of SNAP benefits. So currently, right now, DSS sends us referrals for customers who are applying for cash benefits. So our staff sees them here, registers them, helps them out like that. So that's going to increase with the requirement for those that are not. Oh, they have to have 80 hours of activity a month. So if they're not working 20 hours a week, then they have to be doing job search or some other training or activities. So right now we're just trying to come up with some a plan of being able to work with DSS to provide those services and to get those customers registered in our office and help them. Some of them may not follow through. But we don't have really a hard number yet on what that looks like how many. I don't think it's a ginormous number of customers, but it will increase definitely who we're serving. As for all of us, DSS included. So I think that's pretty much it. I'm just trying to think if there's anything else going on. I feel like I just got all the paperwork submitted for the summer program and we're gearing up for next year already. So we'll be back with more updates on that in the spring. Does anybody have any questions?
No. Okay. Thanks for the update.
Okay, that's it. Everybody stay warm.
Ugh.
Yeah. Bye.
Tammy,
Good morning. Thank you. Sorry about that. Our Hartwick nursing students do their rotation with us Tuesday and Thursday, so I was with a student. Okay, so first agenda item, we're requesting a contract with Osterhout Refrigeration. We have a condenser that has gone bad in one of our coolers at Central Kitchen, and we need to get that replaced. We have 3 quotes for that. Osterhout came in at the lowest, so it's a not to exceed of $16,000. That will be paid from our federal nutrition grants.
is there a motion?
So moved.
Second.
Any questions? All right, move to a vote.
Martini,
Aye.
Bizio,
Yes.
Brockway,
Yes.
Mendez.
Yes.
Pepperton.
Yes.
Okay, hearing no no's or abstentions, the motion passes.
And second, we have a request for a budget transfer to move 33,000 into our personal services full-time line. We're gonna take some funding. We have a current part-time HEAP examiner position that we will be unfunding. And then we're gonna take the balance of those funds out of our contracts line. That's coming from our 100% state funded unmet need grant. And that's what that is gonna do is allow us to take a part-time position, make it full-time. That position usually is only here with us during the heat season. And what's been happening the past several years is we're having to hire a new person every single time. Cause most people are looking for the full-time work. We haven't been successful in finding somebody who wants to come back every year part-time. And it just creates every year we're having to train a new person. So by creating a full-time position, it's not only creating some continuity within that role, but it's also going to help us to fill some of the demands. We need more transportation support to get people to medical appointments, and also just helping with the amount of phone calls to triage, different cases and getting people connected to resources. So by unfunding the part-time position, making it full-time, we're hoping to create some more continuity in that realm.
So the first part of that would be the budget transfer. I'm asking.
Correct.
Yes?
Yeah, sorry. Yep. I gotta get the money in place before I can ask for the position.
Is there a motion? So moved.
Second.
Okay, questions? All right, hearing none, let's move to a vote.
Martini,
Aye.
Bizio,
Yes.
Brockway,
Yes.
Mendez.
Yes.
Pepperton.
Yes.
Hearing no nos or abstentions, the motion passes. Is there a motion to fund and fill the aging services specialist position and then unfund the heat examiner position?
So
However that sorts out is good. I think Bazile moved, Clapperton seconded. Or the other way around. Matters not.
That all really turned out the same, doesn't it?
It really does. Yep. Questions? All right, hearing none, move to a roll call vote.
Martini,
Aye.
Bazile,
yes,
Brockway,
Yes.
Mendez.
Yes.
Clapperton.
Yes.
Motion passes.
And from my understanding, we are gonna go over the clear plan for 2025. I don't know, do you guys have that up in your?
We do not.
So I'll just talk through it then. I don't know if other department heads are doing this. If you don't need it, let me know.
Quick overview.
So we'll just I'll go quickly through our different goals and kind of where we landed with each of those. So our first goal was really speaking to the core services that we provide, enabling residents to age in place by providing home and community-based services and preventing nursing home placement. We were very successful. I think that really was about making sure that we're contracting with every entity that we can, for home care services, for respite services, and then making sure that we have our vendors not only for our emergency response buttons, but also home delivered meals and the congregate dining. So we've been able to get 4 restaurants involved in our restaurant dining program. We are contracting with every licensed home care agency available in our area. And we've had a secure, stable partnership with Connect America for emergency response buttons. Second, we have the focus on supporting our family caregivers. That again is our goal to, not only reach family caregivers, but also get them connected to supports. If we can keep those family caregivers healthy, it certainly goes a much longer way than with the shortages that we have for the workforce. So we are currently contracting with the home care agencies to provide the home care respite. We also have a contract with Krause Community Center out of Sherburne. We have an individual that is participating in our adult day program. We have a partnership with the Alzheimer's Association, which not only brings in additional grant funding for us to provide caregiver support, but it is allowing us to expand those opportunities throughout our community. We also, this past year, really were working with the local colleges, and this semester we were able to, we have an intern starting with us. So our goal is to establish an intern each semester, at least one, if not 2, to also be able to go into the home and provide respite for those caregivers. So that's kind of one of the areas that we were really striving for this past year and building those relationships with both SUNY Oneonta and Hartwick. So that has been successful. Our third priority outcome was regarding just general community outreach, getting our name out there, having people know that we exist, and also helping to maybe clarify some of the misperceptions that might be out there. I think a lot of times people don't realize the amount of services that we provide. So just again, expanding that awareness and knowledge, tabling at as many locations as we can throughout the community. Obviously, we just finished our foundational video this past fall. So we have that available, as well as our Facebook page and Instagram, and just getting our faces out there, throughout the community. And so we've had staff just do a really great job of making our presence known there. So continuing to do that in the coming year. And then fourth was to really focus on our housing issue. We all know there's a shortage of affordable housing and adequate housing for our community of all ages. But certainly the options available to older adults is extremely limited. So we, are certainly excited to see that there's going to be a senior housing complex built in the Richfield Springs area. There's another one in Oneonta through St. Mary's that's going to be converted. So we're starting to see some movement there. We would love to see more, condos or more market rate, non-apartment type of housing available. We're not there yet. That's an effort that we'll continue to work on in 2026 for sure. And then our final goal was just around transportation. So this past year, we worked with Rural Health Network of South Central New York, specifically the Get There program, to develop a volunteer arm for our senior transportation. And the purpose of that was, we're able to provide a lot of medical transportation as well as transportation to the grocery stores and pharmacies within Otsego County, and then about a half an hour outside of Otsego County to our residents. But we definitely have individuals that need to get to Vestal or UHS, Binghamton, up to Albany, for specialists, and sometimes even, the Utica area. And that's, certainly beyond our capacity as a department. So being able to have volunteers that get reimbursed for mileage really helps us to kind of expand those transportation options available to our older adult population. So that's been slow development. The program does exist. That was part of the goals that we had established. And we are working on volunteer recruitment, and that will also continue in 2026.
Great.
So nothing that we really had concerns on that we weren't able to accomplish. I think that the housing component is, not entirely in our capacity, and it certainly depends on a lot more other individuals than we're able to do. But I think overall we were pretty successful this year in achieving our goals. And that's it.
Okay. Are there questions? Thanks for the update and for all the work that you and your staff have done in the past year and have planned for the coming year. So
Thank you very much. Have a good day, guys.
you too. All right, there we go. Are you ready?
Oh, okay.
Do we need to do the executive session first or last?
I would say last,
Okay.
and then depending on what I share and what discussion we might have to make about.
Yeah.
But we would probably get through the vote and stuff
First.
I'd like approval to pay AccuMed $7,899.50.
First, can I have a motion?
So moved.
Second, okay. Can you explain what acumen?
So our legacy EMR, it was, we had an EMR and a billing, a different company for the billing part that they were kind of connected, but they're two separate ones. So we were still posting in them from cleanup. And now we are done posting in them and they want to be paid.
Okay. And just for you folks, an EMR is the electronic medical records. So we're shifting from one provider to another. Which means that for a while there, we were operating two simultaneously while, you don't want to just turn one off and turn the next one on. It never works out. So. All right. Any questions? All right, move to a vote.
Martini.
Aye.
Bizio.
Yeah.
Brockway.
Yes.
Mendez.
Yes.
Clapperton.
Yes.
Hearing no news or abstentions, the motion passes.
Thank you. I would like approval to hire staff social workers in ARS and mental health, that's step 3. I only have the 25 rates because when I reached out to HR, like the contract was still, the rates are starting at 64,611 through 76,741. We did do this last year, but there was no end date on the resolution. I put the resolution on the agenda. But they advised me I'd probably have to do a new resolution for this year.
And I believe the contract has been ratified. I don't know if it's been signed yet.
I have not heard and I didn't get any rate yet.
Well, I mean, once you get the new rates, then plug those in. On we go. Sorry. Is there a motion?
So moved.
Second.
Any further questions? All right, move to a vote.
Martini.
Aye.
Bazil. Yes. Brockway.
Yes.
Mendez.
Yes.
Pepperton.
Yes.
Hearing no nos or abstentions, the motion passes.
Thank you. I'd like approval to purchase the injectables, like the psychotropic medication through Cardinal Health. It's a state contract number PC 68919, up to $29,000. Once we purchase it and show receipt of that, the medical insurance, Medicaid will reimburse us.
Is there a motion?
So moved.
Second.
Any questions? All right, move to a vote.
Martini.
Aye.
Bazil. Yes. Brockway.
Yes.
Mendez.
Yes.
Clapperton.
Yes.
Hearing no nos or abstentions, the motion passes.
Thank you. Approval to amend the contract with the neighborhood center for HVCI services for the original, the 2025 original amount. Contract was $139,933. Actual paid amount by OMH was $290,503. And just so you know, somehow the state, they ended up sending our portion of the money instead of us. They sent it to Herkimer County. And it's literally like taking a year to get this. So this is actually gonna be back pay too, but we just got notice, I think in December, that they finally figured it out.
Okay, great. Is there a motion?
Second.
One comment. Heck on Herkimer for taking our money. I'm teasing. I am teasing. There's a lot of money going a lot of places. Can you refresh my memory what HBCI is?
Home-based crisis intervention, so they'll go, so like if we have a child in a children's clinic, but they need more than what we can do. These individuals can go into the home and work with them as well, and they don't charge insurance or anything like that, so they can work with them depending on the situation, like up to 9 weeks
Okay.
in the home with the whole family.
Oh, great. Okay. You had a motion and a second. Other questions? Move to a vote.
Martini.
Aye.
Bazil. Yes. Brockway.
Yes.
Mendez.
Yes.
Clapperton.
Yes.
Hearing no nos or abstentions, the motion passes.
Thank you, and then approval to contract with the neighborhood center. And this will, again, this is part of the whole we're gonna have to backdate the contract to April 1st of 25, and it will go through December 31st of this year in the amount of $299,711. And again, the state changed their dates as well as the amount, and that's why we have to backdate them.
Is there a motion?
So moved. Second.
Any questions? Right, hearing none, let's move to a vote.
Martini.
Aye.
Bazil. Yes. Brockway.
Yes.
Mendez.
Yes.
Clapperton.
Yes.
Hearing no nos or abstentions, the motion passes.
I have 2 budget transfers from A4310-54 9,000 to A4010-54 9,000 in the amount of 29,658, and that is for the Bonadeo contract. The other one is also for the Bonadeo contract, and that is a transfer from A4250-54 9,000 to A4010-54 9,000 in the amount of 14,829.
Is there a motion?
So,
Second?
Second.
Questions? Move to a roll call vote.
Martine.
Aye.
Bazil,
Yes.
Brockway,
yes,
Mendez.
Yes.
Clapperton.
Yes.
Hearing no nos or abstentions, the motion passes. And is that it for regular? Yes. So I move that we go into executive session for reason F, the medical, financial, credit, employment history of a particular person or corporation, or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation. Is there another one in there somewhere?
No, it's all, contract stuff.
Okay. Is there a second?
Second.
I'm not sure who we need to invite in.
Probably legal and
And of course, board members and adults. So. Okay. Okay, let's move into executive session.
Recording stopped.
This is still the Human Services Committee. It is now 10:22-ish. We are back in open session. I am going to make a motion that we contract with Celeste Johns for as the medical director for mental health. Sorry. My copious notes apparently let me down. Contract with Celeste Jones for medical direction for the mental health director position from April 1st, 2026 through March 31st, 2028, not to exceed 25,000 per year, plus we will pay her malpractice insurance. Is there a second?
Second.
Any questions? All right, move to a roll call vote.
Martini,
Aye.
Bazil,
Yes.
Brockway,
Yes.
Mendez.
Yes.
Clapperton.
Yes.
And hearing no no's or abstentions, that motion passes. And I would like to make a second motion that we create, fund, and fill a temporary business office manager for $40 an hour. That uses 100% state funding for 6 months with a possible 6-month extension.
I'll second.
Questions? All right, move to a roll call vote.
Martini,
Aye.
Bazil,
Yes.
Brockway,
Yes.
Mendez.
Yeah.
Clapperton.
Yes.
Hearing no no's or abstentions, the motion passes. And I believe that is the business we have to do. All right. Motion to adjourn.
So moved.
And we're adjourned. Thank you, Mr. Gibbs.